Hello, welcome back to Toolkit Talks. My name is Jennifer Smith. This is video 3 of 3 of our Toolkit Talks Joy in Work video series. So welcome back. Again, I'm a Public Health Resilience Coordinator with CoCares, the Colorado Alliance for Resilient and Equitable Systems, as well as the Office of Public Health Practice Planning and Local Partnerships at CDPHE. And again, this is video 3 of 3 of our Joy in Work video series. So let's get started. Again, this is the third video, and if by now you haven't already been to the NACCHO website and downloaded the toolkit, please use the QR code to do so. Again, a lot more information was included in the toolkit that we couldn't include in these videos, and it's just good to follow along as we go along in these videos. The toolkit itself is created by the National Association of County and City Health Officials. They use the white paper or the framework for joy in work created by the Institute for Healthcare Improvement. Again, this is the third video, so I would definitely recommend going back watching the first and second videos if you haven't already. Video 1, we did the introduction, the purpose, the principles, and getting ready to prepare. What do you need to know before starting to have these conversations around joy in work? Video 2 were step 1 and step 2. So step 1 was asking staff what matters to you and starting those conversations. Step 2 was identifying unique impediments or barriers to joy in work in the local context. What's standing in your way? What can you do about it? So today in video 3, we're going over the last 2 steps in the toolkit. Step 3 is committing to a systems approach by making joy in work a shared responsibility at all levels of the organization. We did a little bit of this in the first video where we talked about how to create your team and what people are best maybe to have on those teams. Step 4 is using improvement science to test approaches to improving joy in work in your organization. So it's not the most exciting information, but it's definitely going to help you making sure everyone's committed, making sure it's a shared responsibility and it's not falling on one person's shoulders to do all of this work, and then making sure changes you're making are working as you want them to. So let's get started with joy in work. Step 3 is committing to making joy in work a shared responsibility at all levels of the organization. Everyone from senior executive leaders to administrative staff has a role to play in this. Each person contributes. They contribute by creating effective systems, building teams, bolstering one's own resilience, and supporting a positive culture. You cannot just delegate responsibility for joy in work to the Human Resources Department. It is everyone's job. And I know some people working here or watching this may not have a Human Resources Department, so it is your full responsibility. We've already reviewed the framework. This is what you're looking at here is the IHI framework for joy in work and ensuring a joyful, engaged workforce. It shows how everyone is responsible at all levels. So in the middle of the pie, you have the happy, healthy, productive people. Around the pie, you have the pieces that are going to bring you happy, healthy, productive people. And without those, that will not happen with all those components. And you can see around all of that is the responsibility levels. You have the individuals who are responsible for 3 pieces of the pie. You have the managers and core leaders who are responsible for 5 pieces of the pie. And then the senior leaders in management are responsible for the entire outside of that, the pie. Every piece they are responsible for. So when you're committing to make joy in work a shared responsibility at all levels of the organization, here's some things that they advise you to do. List what the team identifies as bright spots and impediments. Ask, what should we tackle first? Ask that all individuals participate in the local improvement work. Be specific about improvement. Take immediate action with team members and ensure ongoing communication and follow through. Engage others and support creative thinking. Use a short list of things you can do right away. That would be a quick win. Provide brief updates as often as you can. So on to step 4, where we're going to use improvement science to test your approaches to improving joy in work. Again, this is the IHI model for improvement. More information on this is in the toolkit, as well as on the IHI website. They have a lot of information about their improvement model, about joy in work and different things like that. So I would advise checking that out. We will have the links here in our description, so make sure you take a look at all of that. And you want to make the change process rewarding and effective. Questions to ask. 1, are the changes leading to improvement? 2, are they effective in different programs, departments, and clinics? 3, are they sustainable? And in our graphic here, this is cut from their website directly. This is their model for improvement. They do a plan, do, study, act model here, the PDSA cycle as they call it. And you're asking more questions. What are we trying to accomplish? How will we know that a change is an improvement? What change can we make that will result in an improvement? And we will go over this more in just a little bit. Setting aims. The aim should be time-specific and measurable. It should also define the specific population of patients or other system that will be affected. Establishing measures. Teams use quantitative measures to determine if a specific change actually leads to an improvement. Selecting changes. Ideas for change may come from those who work in the system or from the experience of others who have successfully improved. Here are some tips for setting aims. 1, state the aim clearly. There should be no room for ambiguity here. 2, include numerical goals that require fundamental change to the system. 3, set stretch goals. Those are goals to reach in a certain time frame. 4, avoid aim drift. Make sure as a team you do not deliberately back away or drift away from it unconsciously. 5, be prepared to refocus the aim, possibly focusing on a certain area at a time. If you need to narrow it down, please do so. Tips for effective measures. 1, plot data over time. So some examples. A could be data on length of stay if you're in a hospital or care place. B could be volume. C could be patient satisfaction. So wherever you are, do different data points on depending on what you're trying to make changes for. 2, seek usefulness, not perfection. Improvement is the goal. In order to move forward to the next step, you need just enough data to know whether the changes are leading to improvement. 3, use sampling. Sampling is a simple, efficient way to help a team understand how a system is performing. 4, integrate measurement into the daily routine. Develop a simple data collection form and make collecting the data part of someone's job. Often a few simple measures will yield all the information you need. Doesn't have to be complex. We don't want anyone taking on too much extra work here, but that could be one person's job, is collecting data. 5, use qualitative and quantitative data. Qualitative data is easier to access and highly informative. And then you can ask patients and their families about their experiences if you're in a patient-facing organization or role. So selecting changes. They give a definition here of change concept. General notion or approach to change that has been found to be useful in developing specific ideas for changes that lead to improvement. So here's some food for thought here. Eliminate waste. Look for ways of eliminating any activity or resource in the organization that does not add value to an external customer. Improve workflow. Improving the flow of work processes is an important way to improve the quality of the goods and services produced by those processes. Change the work environment. Changing the work environment itself can be a high leverage opportunity for making all other process changes more effective. Manage time. An organization can gain a competitive advantage by reducing the time to develop new products, waiting times for services, lead times for orders and deliveries, etc. Testing changes. So now we're back to the PDSA cycle. After generating ideas, run the plan, do, study, act PDSA cycles to test a change or group of changes on a small scale to see if they result in improvement. If they do, expand tests and gradually incorporate larger and larger samples until you are confident that the changes should be adopted more widely. The PDSA cycle is a shorthand for testing a change by planning it, trying it, observing the results, and acting on what is learned. So here are the steps when you're trying out these changes. Step 1, plan the test or observation, including a plan for collecting the data. You want to state the objective, make predictions on results, develop a plan to test the change. So who, what, when, where, what data, etc. Step 2 is you do. Try out the test on a small scale. You're going to carry out the test, you're going to document problems and unexpected observations, and you're going to begin an analysis of the data. Step 3 is the study. Set aside time to analyze the data and study the results. Complete the analysis of the data. Compare the data to your predictions. Summarize and reflect on what was learned. Step 4 is where you act. Refine the change based on what was learned from the test, determine what modifications should be made, and prepare a plan for the next test. Implementing changes. Implementing is the permanent change to the way work is done. I'm going to start over. Implementing changes. Implementing is the permanent change to the way work is done and involves building the change into the organization. It may affect documentation, written policies, hiring, training, compensation, and aspects of the organization's infrastructure that are not heavily engaged in the testing phase. Again, the PDSA cycle, they say a lot of information, but they're really giving you just a lot of details so you understand the process. But doing the PDSA cycle may not take as long as you think, right? Because these changes could be very small, could be very minor changes, but they're just giving you enough, all of the information so you have it just in case you are implementing a big change. And again, these changes that we make sure that you're looking at everything that's going to be affected, right? Because it could affect job aids, documentation, policies, how you hire and what you're training people to do, right? A change, you have to make sure that you're not training the next person the same way. If you've made a change, you need to train them in the new way. It may even change compensation. and aspects of the organization that really just weren't involved in this testing of these changes, but they need to be updated either way. So that may be the more work that you have to do in the end, maybe with this sort of stuff. And then you have spreading changes, which is the process of taking a successful implementation process and replicating that change or package of changes in other parts of the organization. So making sure everyone's aware of the change, replicating that in other departments or areas that you need to. And here are some training and resources for extended learning if you want to. Again, the videos from NACCHO and the videos from the Institute for Healthcare Improvement are here if you want to click those QR codes. We will have an emotional intelligence for supervisors course up and ready if you're interested in that. I'm going to start over. All right, so I think that kind of ends our training for today on the last 2 steps of the joy and work. So your what was our topic today? Oh my God. All right, that is the end of our video today. We discussed the last 2 steps of the Joy and Work Toolkit and the Joy and Work process, which are making sure that everyone's committed as an entire organization. Everyone knows they have a role to play in making these changes and improving joy and work. And then we're making sure to test our changes and making sure we're using improvement science to really make sure that those are working the way we want them to. And we're not making changes for no reason, or making changes that we didn't have quite the outcome that we wanted to, right? And adjusting and changing as we need to, because it's a process. This is going to take a while. This is not a quick fix to improving joy and work. It's a long process. So make sure you understand it. Go back and look at the toolkit, watch some more videos from IHI and NACCHO, which we will link in our description. Make sure you download the toolkit, that you have all the extra information that you need to bring joy and work to your organization and to your team. So good luck with everything. We would love to hear from you at OPHP. If you want to reach out, our email is ophp@state.co.us. And then our QR code here will link you to our training website if you would like to get more information and more training and more tools from us. So we appreciate you watching our Joy and Work Toolkit videos, and have a great day. Thanks so much. Bye-bye.